ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello everybody, my name is Nicholas. I'm your host for today's episode of ECDC On Air. We're filming this in mid-October and the days are getting shorter and a bit colder. We're approaching the winter season when we see a lot of respiratory viruses flying around. So that's what we're going to be talking about today. We have here in the studio Angeliki Melidou, who is one of ECDC's experts on this topic. So nice to have you here, Angeliki. Welcome to ECDC On Air.
Thank you, Nicholas. Nice to be here.
So you've been working on respiratory viruses at ECDC for quite a while, right?
Yes, since 2016, I first came here as a seconded national expert.
Can you start off with the basics and explain to us what kind of viruses that are spreading at this time of the year?
Yes, there are a few viruses spreading this time of the year because of the close proximity that people tend to have in enclosed indoor spaces during the winter months. Respiratory viruses flourish. So we have a lot of respiratory viruses circulating during the winter. It's influenza, of course, A and B, coronavirus, the SARS-CoV-2 that has caused the COVID-19 pandemic, RSV, the respiratory syncytial viruses, but also other viruses like adenoviruses, parainfluenza, rhinoviruses, other human coronaviruses. So there are a lot of viruses co-circulating during the winter months.
And how dangerous are these viruses?
So most of us will have a mild disease. So there are billions of infections, respiratory infections worldwide every winter. So maybe 1 billion, let's say, infections. Out of those, 3 to 5 million will be severe. So worldwide speaking, not only for Europe. And there are occasional also mortality events from these respiratory viruses. So it can be mild with common cold symptoms like fever, fatigue, rhinorrhea, sore throat, cough, and sneeze. But it can also have complications like pneumonia, for example, and occasionally death. So it can vary, severity varies, and there are several factors affecting how severe it can be.
I have the feeling that a lot of people by now, they've kind of forgotten about COVID-19. What would you say to these people?
Well, I think that COVID-19 was an awakening call for everyone that how severe respiratory infections can be. And we need to continue to remember this and hopefully take some precautions that we learned that they are effective into limiting the spread of those viruses. And I know we hear it a lot. It's just flu or it's just a cold. That expression reflects that it's probably mild disease, and it can be, but severity is not evenly distributed. So there are risk groups, like, for example, if you are immunocompromised, if you have other chronic conditions like lung or heart disease, if you are older in age above 65 years, or if you're pregnant, if you're caring for a newborn that is susceptible to severe disease, for example, if she gets RSV, you need to be vigilant and identify early symptoms of severe disease and seek medical care.
Flu is not just, it's just a bad cold. I mean, you would not agree with with somebody saying something like that.
No, absolutely not. I mean, it can be mild. As I said, the majority of us will recover at home with a mild infection, but it can be severe. And as I said, there are several factors. For example, it's the virus that you will get. It's as we discussed earlier, there are several of those viruses co-circulating during the winter. So we hear a lot like, I had it last year and it was mild, so I'm fine. But this is not true, because you can have it again this year. You can have a different virus infecting you this year. Also, if you had influenza last year, you can also get it this year as well, because immunity wanes. So protection from previous infection, or even if you got vaccinated last year, protection wanes after a while. You have the chance to get it. And it depends on the virus that is circulating, on the subtype that is circulating, or the variant. It depends also on your immune status and your health status at the time of getting the infection. So it varies, and it can be mild, moderate, or even severe. Need hospitalization. So it's important to keep that in mind.
And these are viruses that come back every year without fail. Is that so?
Indeed, yes.
But for COVID-19, I understand also that sometimes you can have peaks in other parts of the year, right?
Yes, absolutely. For some viruses, like for example influenza or RSV, seasonality is quite robust. We know that they come during the winter months in the northern hemisphere. That is, first we have RSV peaking autumn to early December or early January. But then we have the influenza peaking after that, and we see that every year now. We saw it before COVID-19 pandemic, and we see it now again after the COVID-19 pandemic. During the pandemic years, we had a little bit of a break from other viruses, but now they are returning in their usual seasonality patterns. But for COVID, we see that we had in the past 3 years, we had summer epidemics as well, what we don't see usually with the influenza or RSV. Now we see it with COVID, and we see with COVID a constant lower but constant circulation throughout the year in some parts of Europe. So it is a little bit different patterns with SARS-CoV-2. But we still need to see, because it's a relatively new virus and still the seasonality has not taken its final form. We monitor it very closely.
But at least we know that RSV and influenza, they will come this year, and then you will most likely then have COVID-19 on top of that. How significant is it that we have these three viruses coming around the same time?
Yeah, co-circulation is a real thing. We've heard of triple demics last year, and we see it after the pandemic that these viruses co-circulate. These three viruses co-circulate during the winter months, and that means that healthcare systems are even more burdened, because we have a bigger number of infections, which will result in bigger numbers of people seeking medical care in their primary care physicians like GPs, and then consequently some of those may need hospitalization. So we have more people in the hospitals. Our hospital beds are occupied by people with respiratory symptoms, and there is a lot of burden due to this co-circulation, which we need to think of it like a little bit as a holistically. Not only we need to protect ourselves, but we also need to protect our healthcare systems to have hospital beds available for emergencies, for injuries, for treating cancer patients, for heart attacks and strokes. So we need to keep that in mind when we need to limit the spread of the viruses and do our part.
Sure. So it's not just about the individual risk, it's also about protecting the functioning of the healthcare systems. Who would be the most people which type of groups in society would be the ones that would be most at risk of ending up in hospital from these diseases?
So yeah, it's quite common with all of those pathogens, but there are also some pathogens that prefer specific groups of people, and I will give you some examples. Usually it's the older population groups, like over 65, that have a risk of getting severely ill. And then we have those that are immunocompromised for other medical reasons. Pregnant women, those with other chronic illnesses like heart or lung disease, and the infants, very young infants, they are also at risk, specifically from RSV, but also from other respiratory pathogens as well. So for some people, as we discussed earlier, it can be mild, but for our grandparents, for a newborn next door, or someone sitting next to us on the bus that may be compromised, these people may get severe infection, they are more in risk.
So moving on a little bit, just to see how is it best that we protect ourselves from these diseases?
So there are thankfully ways that we can protect. And first of all, the most powerful weapon that we have against these viruses is vaccination. And we have vaccines for RSV, for influenza, and for COVID-19 available. And the strategies, the vaccination strategies in the different countries in Europe vary. So you will need to check your national portals for the national recommendations. But there are available vaccines for these 3 pathogens. And then, of course, we have the protective measures that we can take and some small habits.
Maybe just to pause there on the vaccines, do we see that enough people are getting vaccinated?
Unfortunately, not as much as we would like to, especially for the risk groups that most countries have recommendations for vaccination against some of these pathogens for the risk groups. And for influenza, for example, we have not reached in Europe the 75% target for vaccination coverage for these risk groups. And there are a few reasons behind that, but we need to get better. People are tired of viruses, understandably, after COVID. But we need to not underestimate the burden that these viruses can cause. And it's not only about protecting ourselves, it's also about the healthcare system and protecting our loved ones.
So clearly there's still some work to be done there.
Absolutely, yes.
There's a lot of people that, first of all, no vaccine is 100% effective, right? You can still get the disease even if you get vaccinated. What's your comments on that, or to somebody who would say that and use that as a reason not to get vaccinated?
This is not a reason to not get vaccinated if you're eligible for vaccination in your country, because we do know that some vaccines will not protect you from getting infected, but all vaccines will protect you from being severely ill. So we do know that vaccines are effective in preventing severe disease and complications. So that's the reason to get vaccinated.
And as for the safety of these vaccines?
As for the safety, it's a very, very tightly and strictly regulated field. So there are clinical trials, and safety is monitored very closely from the European Medicines Agency, and all of the products that are available on the market and are licensed in Europe have gone through these trials, and they are considered to be safe.
Besides vaccination, then what can people do to prevent themselves and others from infection?
Yeah, I think that this is very important, and we've seen that these measures are effective. We've seen it during COVID. Other viruses basically disappeared during COVID, like influenza, for example, disappeared partially because of these measures that we implemented during the pandemic. So this first and utmost, I think it's that we need to stay at home when we are sick, in order to not spread the virus to others, and use good hand hygiene and respiratory hygiene, like a respiratory etiquette, or using the elbow instead of the hand.
Mm-hmm. So when you cough into your elbow.
Exactly,
or
you
sneeze.
cough into your elbow instead of the hand. And then, of course, always good hand hygiene, or getting rid of, if you're using a tissue, you need to dispose of it properly. I think these are important things that we can do. Also ventilate closed spaces, avoid closed spaces if we can during the winter.
That means like opening windows, things like that?
Exactly, opening windows. If you're high risk or if you are infected and you must go out, you can wear a face mask. And I think it's also very important to know when you need to seek medical care. So if you have shortness of breath, if you have chest pain or dehydration or confusion for the elderly or the very young infants, then you need to seek medical care.
Mm-hmm.
Because there are things to do also when you get infected to treat yourself.
I just wanted to go back to the subject of vaccination again, because there are some groups that can't be vaccinated, like the newborns and very young infants. So in terms of vaccination, what can be done to protect them?
apart from all these measures that we discussed, do not expose the newborn to these viruses as much as possible. There is a vaccine now for to protect newborns. Maternal vaccination it's called, and it's specifically for RSV, because RSV is one of the major causes of hospitalization and severe disease in infants. And this vaccine is administered to the pregnant woman, the mother, and it offers passive immunity, passive protection to the infant. So it crosses the placenta and goes into the infant, the antibodies, and go to the infant and protect the infant in the first year of life. So this is the maternal vaccination. And there is also another preventive measure that's a game changer, that it's monoclonal antibodies. There have been monoclonal antibodies available for a while against RSV for protecting these newborns. And now there is another product in the market that is easy to use because it's a single shot that can be given.
I think you have to explain what is actually monoclonal antibodies. Is that a vaccine or?
Yeah, no, it's not exactly a vaccine. It's a medical product, and it's ready-made, let's say, antibodies that are administered to the child, to the infant. So it's not a vaccine per se, because vaccines offer active immunity, so that you need to produce your own antibodies. These ones are ready-made.
Sure.
So that the infant can use.
I get it. Yeah. Okay. But it's being injected, right?
Exactly.
And for those who do get sick, is there any treatment?
Yes, absolutely. We have treatments for COVID-19 and for influenza, and they are administered after prescription from the clinician. So they will need to check your situation, like the risk, the symptom that you have, the timing, when did the symptoms start, and consider if they will administer these antivirals. These antivirals are compounds that inhibit the virus replication or some parts of the virus life cycle. And we need to note that for RSV, it's basically supportive care that we can provide to the patients. For example, oxygen or fluids, but there is no approved antiviral in Europe at the moment.
Are they available just as treatment, or can they also be used as a prophylactic?
Some of those antivirals can be used as prophylaxis, so prevention. If you get exposed to a virus and you are in a risk group, you may be eligible for getting an antiviral for prophylaxis. So you need to be aware that you could seek medical care and inform your clinician that you have been exposed if you are in a risk group, and see if you are eligible for getting an antiviral for prophylactic use for COVID-19 or for influenza.
And tell me, what's ECDC doing now in the coming months to tackle the winter bugs?
So at ECDC, we are, in my team, the respiratory virus section, we are working very closely to monitor viruses that are circulating, specifically these three, influenza, SARS-CoV-2, and RSV. We are working very closely together with the member states who are providing data to us on a weekly basis. And then we are analyzing the data and assessing the situation. We are interpreting the data and presenting them weekly in the weekly bulletin that we published in a dashboard format, but also have a summary, an interpretive summary that we interpret the situation and provide our assessment to the public. And this bulletin is called ERVIS Bulletin, and you can visit it at ervis.org and explore it further.
So if you could share just one piece of advice with our listeners now for the upcoming season, what would that be?
Say if you are in a risk group, I would say to go to your national portal, check if you are eligible for vaccination for any of those viruses, and get your vaccines early. And for the rest of us, and for all of us, basically, just try to follow these simple steps, like the simple precautions that they do matter, like avoiding contact with others when we are sick, and good hand hygiene, clean the air, and this type of precautions.
Thanks, Angeliki. That's all I have for you today.
Thank you. Thank you, Niklas.
Thank you for watching this episode of ECDC On Air. If you are interested in more information, you can go on ervis.org. The link will be in the description, where you can find all the latest epidemiological data about these viruses. You can also go to ECDC's website or social media channels for more information.